Hello, welcome to our first micro lecture in INTM 6307, Theory and Philosophy in Bioethics. Medicine is defined in different ways. According to my trusty Roget's Thesaurus from early 1900s, notice the binding falling off, medicine is defined in a few ways. Actually, the paragraph is very long, and if you're interested, I'll take a picture of it. But let's start with, say, the first 10 words. Medicine, leechcraft, physic or lichdom, both archaic. Therapy, anatomic medicine, biomedicine, comparative medicine, clinical medicine, constitutional medicine. This may be more than 10. Dosimetric medicine, experimental medicine, folk medicine, general medicine, group medicine, holistic medicine, internal medicine, materia medica, neo-Hippocratic medicine, physical medicine, public health medicine, tropical medicine, veterinary medicine, psychosomatic medicine. There we go. So, for Schramm, treatment consists of a theoretical science as well as a practical aspect, art. As a theoretical science, medicine rests on speculation regarding patients' care. While medical students study the anatomical structures of human homeostasis and conjecture as to the best course of treatment and optimal outcomes, each patient encounter is unique and contains the conceptual, the factual, and the normative. Please be aware that all semester will be using these three criteria. Consider how the conceptual, the factual, and the normative apply, for instance, to the curriculum of medical students here at UTRGV. Stay tuned, because after this, and posted in our first week module, I'll have 3 different sections. One for you to consider the conceptual, factual, and normative regarding medical student education. One regarding the knowledge claims of the average US citizen versus COVID-19 is number 2. And number 3, how is pain fleshed out differently between the genders in men and women? Because pain experience is experienced differently between genders. Okay, so let's keep going. Conceptual, factual, normative. Let's start with the conceptual. The conceptual rests on an observer's values, beliefs, ideas, thoughts, and impressions. Let's begin with the nature of suffering. Since the philosophy of medicine is defined by Schramm as the metaphysical, epistemological, axiological, methodological, and conceptual, I'd like to explore suffering on the theoretical level. Pause for a moment. What is suffering exactly? We have all suffered. Let's begin with metaphysics and suffering. Metaphysics is the branch of philosophy that studies the nature of being, or first causes. Ancient philosophers asserted that metaphysics was a science, like biochemistry, for instance. Where does suffering begin? Does it erupt in the psyche first, or in the body? When you get sick, is it mental, physical, or both? Which comes first? Epistemology is the branch of philosophy concerned with knowledge claims. In our beginning lecture, you read about how knowledge was traditionally defined as a justified true belief. If you have not looked at this section, please go back and reread it, because philosophy's definition as love of wisdom and epistemological claims of Ernest and Brenda's birthday are explicated. How does Ernest really know and is really justified and has a true belief about his friend's birthday? Suffering and epistemology are interconnected, but could we ever say they were unjustified when a person is suffering? What about chronic pain? How do we know what the person has? It's often misdiagnosed, underdiagnosed, and never solved. And for instance, what about hypochondria? Can we say the person isn't suffering and doesn't know that they're suffering? These are questions to be asked of theories of knowledge, and I'll ask us to examine our own epistemologies. Let's now look at methodologically. How would we define suffering? When you go to your physician and you're sick, she or he asks on a scale of 1 to 10 how much pain you're in now. However, people interpret pain and suffering subjectively. Women and men experience pain differently. And actually, based on physiology, hormonal structure, and other criteria of genomic differences and differences in our biochemistry, women experience more pain. I will post that article. The nature and types of values and value judgments define an axiological supposition. Do humans value different types of pain differently? Is some suffering greater than others? So is a metaphysical only suffering of, say, depression greater than a suffering of someone who's imminently dying, or of a child who scraped their knee outside? Is the value of suffering different for different cultures? Because it is. How is suffering interpreted different depending on the cultural system that you're within? Now we've examined suffering from a conceptual vantage point. The second criteria is the factual. When someone is suffering, what is factual about the condition? We can quantify, measure, ask about, and attempt to alleviate suffering through therapeutic, pharmacological, psychological, behavioral, and situational case-based criteria. Most all clinicians agree on how suffering pans out in certain conditions. Let's take a simple example, a paper cut. Some are deeper than others. Most all involve this factual component of our largest organ in the body being lacerated by the notebook we were writing in at the time. And by the way, that's an example of how intellectualism can obviously harm you. Okay. Factually, we usually clean the paper cut and bandage it. All right, let's turn to bioethics as a normative component of reasoning. So the goal is sound, clear, systematic reasoning that is played out in a normative edict, which is what you should do. It's a prescriptive action. Bioethicists are trained to suggest certain actions are more efficacious than others based on your training and my training. Normative theories fall into four broad categories. The virtue ethicist aims for moral excellence and asks, what kind of person should I be? The utilitarian is always a hedonist, or asserts all people seek pleasure. But utilitarians also assert that some pleasures are greater than others. For instance, overall health is a greater pleasure than just sheer athleticism. And the greatest good for all is the goal of the utilitarian. Deontologists are duty-based, and prima facie obligations are those at which first glance are ones that all people should act upon. For instance, to be beneficent where one can is a duty, specifically for Kant. That's his exact quote. And it's the backbone of medical care, or doing good. Finally, justice theorists, an overall aim of our MS in bioethics, seek the fairest playing field for all involved. Justice theorists aim towards not only leveling inequities, but also for lifting up the least well off as a mandate of their telos, or ends. Okay, this is our first overview for the semester, and I look forward to your continual perspectives on the conceptual, the factual, and the normative. Thank you.